Saw one of my mixed martial arts patients come in following elbow arthroscopy. This is Dr. Mora talking about elbow arthroscopy in mixed martial arts. Elbow arthroscopy x-ray before, this is the after. The patient was having catching and locking of the elbow and was not able to extend the elbow. This is what we saw on the x-ray before surgery. We saw osteophytes, that's thickening of the bone anteriorly, loose body and thickening of the bone on the coronoid fossa. So you can imagine when the patient would flex like this big osteophyte would end up hitting that one, and this loose body would move throughout the joint, damaging it, causing problems, causing stiffness and loss of extension. This is the after. As you can see, super clean in the front, loose body gone, the osteophyte off the coronoid is gone, and the osteophyte off the anterior aspect of the distal humerus is gone, and the loose body is gone in the back. So now that the joint is cleaned up and the capsule has been released and the loose body is gone, the loose body will no longer damage the joint. The capsule that has been released will now allow better motion, and these big spurs that have been removed will no longer impinge on each other, so the patient will have the potential to have full extension and full flexion, and the longevity of the joint be improved as well, because those loose bodies do cause damage in the elbow. I hope you enjoyed this very brief teaching session on degenerative changes of the elbow in mixed martial artists and what the elbow looks like after surgery. It looks really clean. Reach out to me if you have any questions. You can also go to my website and ask for a virtual session.